is Hope Newport. I am the IFOPA Family Services Manager. So I work to support our patients and their support network with the resources offered by the IFOPA. And I'm excited to partner today with Terry Hickam. So I'm going to introduce her in just a minute, but I wanted to start by just going over a little bit of information about this webinar platform to help everyone, navigate their way around. So first of all, I wanted to point out that as attendees, you're all muted, so you won't be able to ask questions verbally. And that's just to ensure that we have very limited background noise and that you're able to hear Terry's presentation. If you'd like to submit a question, along the bottom of your screen, you'll see a Q&A or a chat feature. So if you would like to submit a question publicly, you could send that through the chat. And if you have one that you'd like to ask privately, you can do that through Q&A. That's really the difference between those two things. We will wait to answer all questions at the end of the webinar. So we have some time allotted for that at the end. And just a reminder that this webinar is being recorded. So if you're someone who likes to take notes, don't feel too rushed to write everything down. You'll be able to go back and reference all of Terry's very helpful information that she has on the screen, but also what she's saying when the presentation is posted online or when the recording is posted online later this week. So one other thing I did want to ask is that if you are joining us as a parent or teen duo this evening, if you could just go ahead and type into the chat box or let me know through the Q&A that you're joining as a parent and as a teen participant. So now I'm going to introduce Terry Hickam. So Terry is a clinical social worker and certified case manager. She is the Transition to Adulthood Program Manager at Children's Mercy Hospital in Kansas City. Her job is focused upon training staff and developing use of a national model to prepare adolescents and young adults in self-care, health management, and eventually successfully transferring to the care of adult healthcare providers when they age out of pediatric care. Terry has practiced 30+ years in both pediatric and adult care hospitals. She has also served as a Medicaid managed care case manager, nursing home social worker, and nursing home consultant. Her clinical passion lies in seeing care coordination for people with chronic healthcare needs done well. So first of all, thank you so much, Terry, for putting together this amazing presentation and for joining our community for the first time. Terry and I have been working together over the past several months, and she has demonstrated a great passion for serving the FOP community. So we're so grateful to have you with us today, Terry, and I will let you take it away from here.
Okay, well, thank you very much, and it is my privilege to be here today talking with you and appreciate the opportunity to share this information with you. So many times people will remember when they're helping their children learn basic skills like how to do laundry and how to do a budget, etc. They think about those things, but they often forget how important it is to teach their children and model for their children the skills that they have learned in terms of managing their health. So that's what this program is all about. So Children's Mercy is a not-for-profit independent children's hospital. And I want to stop there for a second because it makes a difference if you're in if your child or you are in a place where you're in a hospital that only serves children, or if you're in a hospital that serves both children and adults. It's an easier move to within the same system from pediatric to adult care if you're in a hospital that has both. So just know that that's just another one of the leaps that you have to make. So Children's Mercy is right on the Kansas City border, Kansas City, Missouri border. So we're right like about a mile from Kansas. So we have a lot of locations in our area, and like all children's hospitals, we serve a pretty wide region. We're between St. Louis and Colorado, kind of in our catchment area. So I have to assume that you are here today because you're starting to think of, or maybe you've been working through a lot of the changes that happen as you or your children reach adulthood. So there's a lot of things to think about. Some of those you may have already worked through, and some of them you have not. So we plan to talk about today just the concept of transition to adulthood and what's included for you to have a successful transition to an adult care provider, or just an adult approach to managing your care. For example, if your primary care doctor is an internist or a family medicine doctor, then they'll likely continue to see you, and you'll be starting for them to stop treating you like kids and start treating you like adults. Then we want to share with you the biggest biggest place for you to get research information and model information about transition planning, called gottransition.com. So that's the model that Children's Mercy uses, and that we are promoting other people use. So we'll talk about a lot of tools that we use to help people learn. I'll show you the ones I like the best. Then we want to take a few minutes, and Hope has helped me to think about what's important specifically to learn about and to do to feel like you understand FOP and what you can do to help manage that well. We'll spend a little bit of time talking about health insurance coverage, both private and government funded, and what to think about as children become legal adults. And then also recognizing that health is not only physical, but also mental. So thinking about what you could do to help optimize your mental health. So one thing we know is when children grow, they grow up, and eventually they grow up to be adults. And as children are very young, it's obvious that parents and adult caregivers are going to basically do all of that care for them. But as they get older, we want kids to take on more skills and to become more independent and feel good that they are prepared to go out into the world. And that's what this is all about. So we tried, Hope and I tried, we played with this, and we just weren't able to do it. But I wanted to share, would like for you after the presentation to go into our website. So it's childrensmercy.org/transition, and at the bottom of the first page, you'll see two videos. The one on the left is for, just says teen transitioning. Those are for patients who have the capacity to learn and the capacity to manage. And the other one is for patients who may have intellectual or developmental disabilities. But it'll give you an idea of many of the topics we cover with our patients and families using this model. So why do we do this? Why are there transition to adulthood programs? So there have been a lot of advances in medicine and in healthcare technology, and children who may have died before they became adults 10, 15, 20, 25 years ago are now living into adulthood, and there are more and more of them. So it's recognized that both pediatric and adult care physicians need to pay attention to this. It used to be just a pediatric thing. They'd take care of the pediatric care, and that was it. But now for the pediatrician, it's making sure that they're communicating to a physician who's going to continue the care as our kids graduate from Children's Mercy, how to care for and manage needs for rare conditions and other conditions like FOP. As you already know, because you're living it, there aren't a lot of doctors who really even know what this is, and so you have to be the teachers. And so our pediatricians also need to be making sure that they share that information to the adult provider at the time that you're transferring the care. And for the adult care doc, they need to be asking for that medical information to learn about those conditions, anything that they're unfamiliar about. So this report came about from the American Academy of Pediatrics, and it was a partnership with them and the American Academy of Family Physicians and the American College of Physicians, because they're all saying, we know that we all need to be working on this. And I'll tell you why that's even more important later. So the program is basically twofold. So as kids become teenagers, adolescents, young adults, we work with them using this model. It's basically when they come in, once a year we have them fill out a readiness survey, and it asks them questions like, Have you ever made an appointment before? And do you know your medications? And do you know what may happen to your medical condition that you would need to go to an emergency room versus your primary care doctor? Things like that. And for them to gradually learn year by year, one more thing, one more thing. So by the time they go to college or they're out on their own, or that they just are moving into the adult world, that they switch to the care of a new adult doctor and continue to learn, but they take those skills with them so that they feel like they're confident that they can manage it. So it's always important for those of us doing this work that we talk about that transition is not transfer. So transition is a really big buzzword right now. It's used in a lot of different ways, and it generally just means moving from one thing or one place to another. But when we talk about transition to adulthood, it's both the joint planning with young adults and their families to help the young adult learn those self-care skills and to start making decisions related to their care. It's also the part of transfer, which is that point in time, which I call the transfer phase of transition planning, a couple of years before you're actually making a move over there to talk and work through and plan for that transfer. So sadly, I continue to hear stories of patients and families who arrived at their clinic appointment, and unbeknownst to them, they're told, okay, this is going to be your last appointment. We've had, it's been our privilege to care for you. And they leave, and nobody's done any planning with them. They didn't know it was coming. They don't know what to ask for, and they're a bit shocked. And a lot of times when doctors talk about it's time for transition, all they're talking about is this transfer piece and not this piece about the planning and the education and preparing you. So, I mean, we recognize how much stress and anxiety that puts on you as a family when something like that comes to you and you weren't planning for it. So when kids get to middle school and high school, there's a lot of things that start to change in their lives, right? I mean, some of them for the first time are getting a part-time job. Maybe they're starting to date, so their sexuality is an issue and they're starting to think about that. Some of them are trying to figure out, after I get out of high school, am I going to go to college, or am I just going to be on my own, or can I even get a job? Am I able to do that? Or parents, you're thinking about the capacity of your children to be able to be employed and do those things. So all those things are happening during this time. So if we wait late to start having conversations, like 17 or so, before we start talking about transition planning, I mean, there's a lot of things going on. It's pretty overwhelming. So that's why the national model says you should start as early as 12 to start having these conversations. And the research shows that generally young adults transfer their care somewhere between the ages of 18 and 21. So the question really is, who's driving the bus through this journey? And the answer is, sometimes it's going to be your healthcare team. Sometimes it's going to be the parents or the guardians or the adult caregivers. Sometimes it's going to be the teens. And at different stages of learning, all of us are going to be working together to help your child and the parents learn how to manage. So this is a great slide that kind of puts it all together about it's everybody's effort. So as the slide shows, to the extent to which your children are able to learn and take on more responsibilities, we all want to work to see that happen. So some of the responsibility is ours on the pediatric side. So it's really taking the time to teach you to understand your diagnosis and your meds and preparing and helping you eventually move to adult care. For the parent, it's helping your children learn to become more independent. It's showing them how to provide the care and then stepping back and allowing them to try. And, just like anybody who plays soccer, you don't become an expert the first go, you have to take some time to role model it and to try out your skills until you feel like you have it down and you're confident that you're able to do it. And the goal is then, just then to support your kids to be able to care for themselves with you available for questions. Some of the responsibility then is obviously your children, that they need to work to learn how to understand their bodies and what's being provided to help them stay healthy and for them to follow a plan that's going to work for them. So that's on their end. And then for the adult caregiver, it's really about offering a warm welcome when you make your first appointment, celebrating what you've learned on the pediatric side, discussing what additional things, where you are in learning and continuing to do that learning, and helping you feel comfortable in that new adult environment, because the adult care hospital and the adult care system feels very different than the warm and fuzzy children's hospital. So parents, for you, I know particularly if you have a child with a special condition, I know that it's hard for you to move from when your children were really little, you being the CEO and basically doing everything for them. And if some of you out there may even self-identify as helicopter parents, and then gradually role modeling, and like I used with the example with the soccer coach, that the coach teaches those skills and does drills with their kids so that eventually when they're out on the field, they have to make a decision about how they're going to execute and how they're going to use the skills and the knowledge to be successful. And that's really what we're asking you to do, is to gradually help your child with those skills and step back and let them practice those skills. So when they're eventually on their own as adults, they feel like they've got it down. So this model really is going from this pediatric model where it's real family centered and we basically do everything for you, to this adult care model where when you go into an adult care clinic, they're going to expect your child to be independent. They're generally not going to expect the parents to come in and accompany them, and certainly not to be giving the history and all the information. They want that young adult to have that. So what this model is about during their teenage years is that to gradually, what we're doing is encouraging their independence, that they're able to feel that they can do it, that they're able to advocate for themselves and manage themselves. So why am I talking about this? So how many docs are really involved in doing transition planning? And this is the shocker of what I want you to understand. So in 2016, it's the last knowledge we have, the last research we have from the National Children's Health Survey, which looks, and they basically found that basically only 15% of the time that doctors who are serving kids with and without special health care needs are really asking them and providing them information about transition planning. So what were they really asking? The questions they asked were, has your child's doctor talk with you that eventually your child will eventually see adult care doctors, doctors who treat adult patients? And are they talking with you about the healthcare needs that your children will have when they become adults? And have they talked with you about health insurance and what you're going to do to keep it, or how it's going to change when they become an adult? And then the last question is, how often is the doctor really working with you and encouraging you to take responsibility, to learn your meds, to learn your treatment, to understand your diagnosis? So the reality is only 1 in 6 docs are even doing anything, and most of them are not using any kind of evidence-based tools. They're just kind of having a conversation with you about it. So that's why we're trying to be formal in what we offer. So we use the resources and the tools from Got Transition. So you can go to their website, gottransition.org, and find all kinds of resources. You'll find videos, you'll find readiness assessments, you'll find all kinds of information out there to help you. And so they use a model called the 6 core elements, which basically says, as I shared before, that starting about age 12, that the hospital should discuss their policy with them, that we really have a plan for this and we're going to work with you on it. And then from ages 14 to 18, we're going to have you take this readiness assessment, have you take this questionnaire once a year and track what do you know, and next year have you think about what you want to learn, and the next year when you come back, monitor how much more you know and assess how well do you know this information and help you tweak and continue to learn those things. Then, as continuing on to that 14 to 18 stage, talking about, okay, now with your health and what we know about FOP and what we know about your health in general, let's develop a plan for you, including your medical summary. What do we want to tell everybody about you and managing your health to keep you as well and healthy as possible? And then somewhere again between 18 and 21 for you to work on transferring to an adult care provider by talking about what are your options a couple of years before you leave. What's your insurance? So what are your options? And let's plan for that. And I want you to research that, come back, let's talk, let's agree to it. So before your last visit, you all already know what you've decided about where you're going to go. And then it's our responsibility in a pediatric world to make sure that we provide that information, but we provide medical records and and you make that appointment with that doctor, and that we make sure we have an opportunity for our docs to talk with each other to answer any questions specific about you. And then after you leave and once you're moving into the adult world, for us to confirm, did you actually make your appointment, keep your appointment? We know that we can make an appointment, but that doesn't mean that either you or that you actually keep the appointment. And so that's a real important measure for us to see that you actually got there and that you felt that that was going to work with that doctor, and then asking you for some feedback about how well we did. So that's the model that we use, and that's the model that nationally is recommending. So when we started our program, my job started about 5 years ago. We did a survey with our families, with our parents, and with our teen advisory boards. And we said, if we're going to develop a program, out of all the things we could do, what's the most important thing in order that you want us to work on developing? So I want you to see that from both our kids and from our parents, they both said choosing an adult provider was the most important thing we could do. So what we did, one of the first projects I did was I asked all of our clinics to give me lists, whatever list they had for adult providers. And unfortunately, less than half of them had any kind of names for adult providers. And a lot of them didn't even have it in a list form. So now we have formal lists. And if you go on our website, you'll find these lists, and I'll show you an example of it in a bit, of our adult providers. And so you can expect, most of you can expect when you start talking about adult providers, it wouldn't be unlikely that your doctors don't even know what your options might be, or may know like one place. And so that's why it's good to start to talk early about it, and so that you can ask them in your advocacy role to talk with you about that. So the other things that you all thought were important was all the things about managing your health, that self-health management piece. For parents, it was a bit different thereafter, about advocating. What do you need to do to advocate for your child for the right things to happen, and exploring the education options and understanding public benefits. On the kids' side, it was understanding what their education opportunities were, what they need to do so they can live independently, and thinking about what the job options are for them. So those are the things that we have been focusing our attention on. So we have a hospital-wide program, and very few hospitals have that. They often have one clinic or a couple of clinics only focused on those with the most medically complex needs. And we said, Kids who don't have health problems need to understand those things too. So our vision is that every eligible patient we serve is going to transition appropriately and successfully to the care of an adult provider before they're 22. And the vision and the mission is really about engagement, that everybody's doing it, that the patients, the families, and the providers. And when I say providers, that's a term in the hospital that usually means medical doctors, so those that have an MD or a DO degree, or advanced practice nurse, so an APRN or other advanced practice nurse. So those are providers. So that everybody gets involved in this process so it's consistent. So here, no matter where you go, you're going to expect once a year to fill out this survey. We're going to have a conversation with you about it. We're going to provide you education, and then we have you pick a goal you want to work on. So that's the model, and that everybody's embracing it, that we recognize how important it is, and that the doctors, the adult doctors who are going to take on your care and assume your care from pediatric care, understand this process as well. So this is our policy. The first time we introduce our program, we show that video that I showed you a minute ago, and we discuss our policy. And the policy basically says on the right side, we've got this program and we want to individualize it to you, and we're going to work with you on setting goals. You're going to help set your goals. Each clinic is going to, may have some different specific ones. And that when you're medically stable and you're fully ready to transfer somewhere between the ages of 18 and 21, we're going to work with you on that. Then the left side is all about recognizing that at 18, your child's going to become a legal adult, and a lot of things are going to change. The first one being that parents, you can't consent for their care anymore, and you can't have access to their records unless they allow you to have access to the records. And so it's recognizing that that's coming. And the other thing we say then is, parents, if you have a child who is unable, who doesn't have the capacity to be totally independent due to their physical or cognitive abilities, we're going to work with you. And what we do is at 16, so I'm mentioning this to you for those that it applies to, at 16, social work becomes involved with them to talk with them about the legal options for guardianship and conservatorship and durable powers of attorney for healthcare and powers of attorney, so that when they turn 18, you can go to court to get the right kind of legal support so that you're doing the right thing. So I'm sharing that with you because if that's your situation at 16, proactively you can advocate and ask for that help, and social work is usually the professional that's going to work with you on that team. So this is what the readiness assessment looks like. This is the standard one for children who are capable of being independent, and then there's also another one for youth with intellectual and developmental disabilities. For this one, there's also a parallel one for parents, and what they suggest is that the parent fills it out, and then theirs out separately, and has the youth fill it out, and then you compare them to see what each of you thought that you knew. And parents, you're often surprised that your child may know more than you think they know about managing their health. So there's two questions here that are really important when we are talking with you and we're asking you to fill this out. It asks your children, and this is for your children to fill out, how important and how confident you are. So how important is it for your kids to say they want to prepare for this move to moving to an adult, and how confident do they feel in their ability to prepare for it or to learn this? So if it's less than a 5, that's really where the conversation is. It's like, tell me why you don't think that's too important, and what would make you feel that it might be important for you. A lot of times when kids go to college, that's something that, pardon me a minute. So we want to make sure that they understand it's important. And basically when they answer the question, like, I know my medical needs, they're going to say, yes, I know it, or I need to learn it, which is basically no, I don't know it, but I need to learn it, or someone else has to do this for me. And so it's not that, oh, my parent does that for me now. It's that I cannot do this and someone else is going to have to do this for me. So that's the way that the questionnaire is set up. So you can go into gottransition.org and pull out these 2 or 3 readiness surveys, transition readiness assessments, and you can print them off and you can have your child fill this out. You can fill it out, your parent one, and then you can take that with you to the clinic and tell your doctor, we want you to start working with you on this. So that's one of the messages for advocacy that I have for you. So the other thing we do is that's a little bit unique is we also ask our kids and our parents, we want you to set one goal that you want to work on for yourself. And when we, as our team here, our parents and our teens that are involved with the transition program and who we call our champions, the healthcare professionals, the social workers, the nurses, the doctors who are the ones who really feel strongly about doing great transition planning, we came up with about 30, but we all collectively thought this was the 10 most important. And so we ask our families, pick one of these out of the for the next year that you want to work on, because we think it's more important for you to pick a goal because you know where you are and you know what you're most interested in this next year, what you think is most important. So we ask people to pick one of these goals. So one of the goals that we ask is for people to sign up for the patient portal. So I don't know if you're signed up or not, and if you're not, my request is please sign up. There's a lot of great advantages to sign up for the patient portal. You, for those of you who are not familiar with it, you can schedule or cancel appointments. You're able to view your lab work and your other weekend list. You can go and look at your clinic notes from the doctors. You can view your medications there. You can message your provider. And the value of it when you transfer, and what I always tell our families when I'm in the clinics is that you will always have that available, all those records available to you if you're connected to the patient portal. I don't know about you, but at Children's Mercy, they say this is going to be available forever for you, not just the next 5 years or 7 years, like, your tax records, but it's always going to be available to you. So you can go back and get that special test or x-ray or evaluation that was done by a provider. So we think that's really a really great value and why it's a great thing to be connected to the portal. So we know you look to us to tell you about resources or educational information. So I'm here just to say staff need those tools and resources just as much as the patients and families do, because we need to provide accurate information to you that's evidence-based, and we want to be very clear in the information that we give you. So one of the things some of our families told us is that we weren't always providing accurate information. So we've been trying to create materials that everybody is consistently using, so we know that the message is consistent and that the information is correct, and it's the same message. It's the same minimally message that everybody's getting. So what's one of the tools that we think is a great thing for you and your children to use? Surprise, it's your phone. So as you know, your kids are probably glued to their phones. The nice thing is that all their medical information can be put into their phones, so they really have it with them. While we want adolescents and young adults to know a lot of things, they don't have to necessarily know every bit of the detail, but they have to know where to get it, and they have to have a basic sense of it. So we suggest that you put that medical information in your phone and their phone to create a medical folder related to all of the things that are important, and that you use those apps to manage your care. Now, Children's Mercy, I'll tell you, is testing an app right now that's all about managing this information and building and working on, it's a game kind of thing, to show that they're gradually learning more and more. So hopefully in a couple of years you'll hear about the My Care Tracker app, and you'll be able to take advantage of that. But in the meantime, you can put a lot of information in there. You can take pictures with your phone of the documents and quickly have it available. So here's the message. You've got 11 seconds when you introduce yourself to a new doc before they interrupt you. So that's the latest information from last year. Now, a few years ago, it used to be 18 seconds, so it's even worse than it used to be. So why do I tell you that? So the whole point is we don't want you or your child to hem and haw when you're meeting a new doctor, whether it's the school nurse, whether it's the emergency room physician, whether it's the health clinic at the college, whether it is your new primary care or specialty care doctor when you go to adult care. We want you to be able to very concisely explain your care. And so this is my favorite resource out of all the things we use. It's called the 3-sentence summary. We are using this with the permission of Sick Kids for Children in Toronto. They created this, and it's my favorite. So it is being able to say very quickly, you can see the 1, 2, 3, what you need to say. So for example, you see the example here. I've got my own that's similar. Hi, my name's Terry Hickam. I have moderate persistent asthma. It's triggered by mold and allergies and exercise. I have never had to be hospitalized, but I've had to take my albuterol inhaler probably 3 times a year. And number 3, I'm here today because you're my new doctor, or I'm here today because I'm wheezing and it hurts and my rescue inhaler's not working. So it's learning what we call, what everybody understands is our elevator speech. We want your child to learn and you to learn what you would just use to describe FOP very concisely, so if you knew that that's why you're going to the doctor, that you would be able to explain that. So 3-sentence summary, that's a great tool. The second tool we like a lot is called the My Health Passport. So it's a free document you can create online. There's about 70 different disease-specific ones and then a generic one. So obviously FOP is so rare, there's not going to be one for that. But the ones that are there, like for diabetes, and I'll show you sort of this if you go into the website. So if you just Google My Health Passport, sorry for the announcement in the back. So if you go to Sick Kids My Health Passport, you will be able to see this, and you can just click on whichever one of these you want. And if it were asthma, it would already have the most common diagnoses. You pick which one is yours. The most common medications, you just have to click which one is yours, but then write down what dosage and usage you have for that. If you have an implantable device or special equipment, you write that down and say where you're getting it and where the supplies are and those phone numbers, as well as your doctors. So you would use the generic passport. You could put up here that you've got FOP, when it was diagnosed, some description about it, and then go on down and provide other information that you could put it all in there. And then what you do is you print it off and either take a picture with your phone or fold it up and put it in your wallet. So the one limitation with this is that you can't change any information. You can't save it. You'd have to go back and start it again. But it's free and it's a great little tool, and I hope that you'd spend some time going and looking at it. And the nice thing is, it's not just for kids. It's got all kinds of things in there that adults could use as well to have that for themselves. So we also have a resource that is in childrensmercy.org/transition. If you look for the All About Me workbook, this is sort of our all-in-one, especially if you're just getting started or if you're later getting started. This is one that we hand out. It's about 40 pages with all kinds of things about transition planning. You can print this off free of charge from Children's Mercy. So it's got the My Health Passport, the 3-sentence summary, information about finding a new doctor, setting goals for yourself, some information about the patient portal. So there's a number of different things in there that would be helpful for you. So this would just be a good one to print off so you'd have all that information in one place. So Hope and I talked about, okay, so if that's this for transition planning, if that's what we're looking for, how can we talk about you understanding and thinking about, so how does that translate? What would you want and what would the providers want you to understand or your children to understand about FOP, and what may trigger FOP to progress? So Hope was kind enough to share, these are the things that you would avoid. It's accelerated by trauma. So things like getting shots, having surgery, having falls, all of those things could really cause problems for you. So what does that mean? So what can you do for your lifestyle to try to minimize the risk for that? So the first is trying to make sure you have great dental hygiene, that you do a good job with dental care, really, brushing your teeth well a couple, 2-3 times, using floss, to avoid any dental surgeries. They use fluoride now. They also have sealers. So trying to do everything you can. Because if you have to have a shot or have to have any kind of dental work done, it might spur that trauma and new bone growth in the jaw. So that's one thing you can do for your care. The second thing is lung health, because, as you know, with that additional bone growth around the ribs, it can restrict your lungs, and so that you can't expand them as fully as you might. And having the ability to have that strong lung function is really, really important. And so using a spirometer, I don't know how many of your docs are already got you using that, but being able to use spirometers to practice and remember good deep breathing is a good way to promote that good lung function to maintain it. Then the third thing would be to avoid high contact sports. So, no sumo wrestling, no football, no probably basketball for some of you. So it needs to be contact sports that that you would not put yourself in a lot of risk for injuries, for falls that could trigger FOP. So archery could be something you could do. I thought bowling could do that, although it did say I really could not stop you if you dropped that on your toe. There wasn't anything I could do about that, but otherwise we would it's fairly a good sport that would minimize the chance of you having some kind of injury to yourself. So that, and being able to use headbands, helmets, things like to minimize the chance that you would harm yourself, and that trauma could cause the FOP to kind of go wild on you. Then the last thing related to the physical health is trying to create that safe home environment. We know as FOP progresses that it could limit your stature, the strength that you have, the balance that you have to walk. And so being able to adapt your home using handrails to help with that. I know that some of you use walkers, some of you use canes, some of you use other adaptive equipment to help you. Anything you can do to help you with that is just another tool to keep you as safe as possible and minimize the risk. So we've talked about the physical. Now we'd like to talk with you about the mental health. So we know that there are a lot of practical ways for you to take care of your mental health. This was a quick down and dirty, but it's very important not to isolate yourself. So to the extent that you're able to socialize with others, that you find ways for people to make you happy, to get around and talk, to stay in touch, to watch your diet, to try to eat healthy, to help your body be as good as it can, to practice good hygiene, both dental and physical, to take a break, to recognize that things will stress you out and you need to allow yourself some downtime so that it can balance that out, to get enough sleep, recognizing that when kids are teenagers, their biorhythms and their sleep cycle get totally out of whack. So do what you can for that. To stay as active as you can, and to drink responsibly. I mean, now we know it's not just drinking responsibly, but there's a lot of states that have marijuana, and so anything in moderation and recognizing that those things impact the brain. So in terms of behavioral and mental health and moving on to adult care, if your child is currently seeing some type of mental health provider who cares for children, you need to ask them, will they continue to see you as young adults? Now, a lot of times they will. A lot of our providers see kids, and then they continue to see them into young adulthood. But if they do not, you need to think about that as well. Where are you going to get your care? And are you on medications? Lots and lots of kids are on medications for anxiety, for depression, for ADHD, and other conditions. So the question is, who's going to be prescribing those meds if if you had a psychiatrist prescribing them, and now who's going to be prescribing them? For example, with ADHD, it's a controlled medication, and you have to have written scripts, and you can only get them for every 3 months at a time in some places. So sometimes your primary care doctor is willing to manage those psychotropic medications, but sometimes they're not. So planning for that is good for you to do too. So 18 is coming when kids become legal adults. So there's a lot of things that are impacted. So one of the things that we want kids and young adults to be thinking about is we want you to get connected to care with adult providers to avoid using the emergency room. So when you connect with your primary care and your specialty care provider, you avoid unnecessarily using the emergency room as your primary care home. One of the things the research shows is it's normal for kids 18 to about 28 or 29 to basically stop going a lot of times regularly to their doctor. And so then they end up using urgent care or using the emergency room for their primary care doctor. So it's we want them to understand all the levels of care in their mind when they think about their health, because when it becomes unstable or when there is some kind of problem, we want them to think, if it's a cold or it's a virus or something, is this something I can have taken care of by my PCP? If it's after hours, do I need to go to urgent care, or do I need to go to the emergency room? Is this something that is the extent that I do need to go to the emergency room? And so while we're talking about this, it's a good subject to pair with understanding their health insurance and how much more out-of-pocket expense it is if they pick the ER or urgent care than if they're able to get it taken care of in the primary care doctor's office. So God Transition also has this really nice document about finding a new adult doctor. So here's questions that you can ask your pediatrician. At what age do I need to change? And can I have a copy of my medical record or an emergency care plan? And are you going to help me move? And then the things that you need to know about before you visit that first doctor. I mean, do they accept your insurance? And what should you expect their first visit? Do you have to pay for parking? All of those things are important questions. And so this gives you a great tool, again, to take with you to the doctor's office or when you're calling the doctor's office, adult doctor's office for your appointment. So one of the things that's recommended is that your doctor write a one-page summary. So I don't really know who is providing your FOP care, but Hope again was kind enough to share this information that's on your website, explaining that FOP is a soft connective tissue issue that progressively turns to bone. And it's a rare genetic condition in which the body makes extra bones where bones shouldn't form. So that part of it, you might even want to put in your 3-sentence summary, and then have somewhere this information. This would be someplace you could take a snapshot so that you would have an explanation of what FOP is. That is a real concise explanation of it. So creating that one-page summary is something we recommend. So a reminder that the #1 request of our families is to have these adult provider lists. So this is what our adult provider lists look like. But again, ask your doctor if they have a list, or start to help you create a list. If you have commercial insurance and your doctor doesn't think they know of anybody, then at least get the list of those specialists that are in network for you to take to the doctor's office and start to discuss it. So that's what you can do to plan. The other thing is, in terms of trying to find a new doctor and trying to find a new primary care doctor, is that all states have federally qualified health centers. They're also called FQHCs, and they're a great option for people who have little or no insurance, and they're great options for people who live in more rural or less populated areas. Every state has a list of primary of these FQHCs, and you can just Google FQHC by state and or with the name of your state, and it should pull up where you can find a list like this. Another value of the FQHCs is they have primary care, dental, and behavioral health care all available within the FQHC. So for Missouri, you can see every agency, the name is different. In Missouri, my list comes through the Primary Care Association. In Kansas, it comes from here. The best directory I have found to try to find a doctor for you for primary and specialty care is through WebMD. So you may want to write this one down. So it's doctor.webmd.com, and it allows you to identify by state, by town, by specialist, what insurance you have, and the most important thing too is whether or not they're currently accepting new patients. Sometimes you'll get a list and nobody's accepting new patients. Unfortunately, if you have Medicaid, most of their directories don't even tell you if when you're looking at the doctors in your area, if they treat kids or if they treat adults. So it's very frustrating. So I think this is the best directory that I can give you. So understanding health insurance, we have learned, and this is a national information that we know, is that adolescents and young adults generally know very little about understanding their health insurance. So parents, your ability to take a look at the insurance and your insurance card with them and help them understand the terms. Often if you use the example of car insurance, and when they go into, when they start driving, they understand that the parent is buying car insurance, and that if there's an accident, that there's going to be like a $500 or $1,000 deductible. So it's use that, but start to talk with them so they understand that when they go to the doctor's office, they may have a $10, $20, $30 copay, or if they go to the emergency room, it might be $100, and what you're paying for a premium. So start now helping them understand that. So it's very easy just with their phones to take a front and back picture of the insurance card. So other changes with insurance. So if your kids have children's Medicaid, it's going to end at their 19th birthday. So it's a children's benefit, and so they're going to have to meet guidelines for adult disability, basically Social Security disability, in order for them to qualify to be continued on Medicaid as adults. For kids who are in foster care, if any of you out there are in foster care or you know somebody who's out there, they age out at 18. And they can continue free health insurance until age 26, but they have to ask for it. Hopefully they've been offered it, but sometimes kids just want to get out of foster care and want nothing to do with it. They can not participate in anything else than the insurance, and so that's really important for them to know that they can be covered through 26. And then many of you know who are covering your kids through commercial insurance, you can cover them through 26, and you may be able, depending upon the degree of disability, to extend that coverage. You will need to talk with your employer and at the HR person who works with insurance to understand if there's an option for you to extend insurance, and those are usually for the most disabled, the kids that are most disabled. So, so for mental and behavioral health for the insurance, again, you're going to ask if they have insurance, if they qualify for disability, if they're going to lose their insurance, and if they're on meds, how are they going to pay for it? There are a lot of, if you've heard of GoodRx or NeedyMeds, places where you can get discounted meds. So a reminder, only 1 in 6 doctors are doing any kind of transition planning. And most of that's on the pediatric side, so very less on the adult side. So my, again, I'm just advocating for you to take the information to them. Just bring the tools. You can take the Readiness Assessment, these other tools I've talked to you about, the questions that you know are being asked. Doctors, are you talking to me about this information? And then this is our website. So this is childrensmercy.org/transition. If you have questions, you can email me or call me if you've got a question. There are a lot of tips and information on here. One thing we didn't really cover, there wasn't time, was to talk about guardianship options and disabilities. There's a lot of resources that we created there for you to look at to be of help. So I've run out of time. I know there's just a couple minutes for questions.
Thank you, Terry, for covering all of that so smoothly and so expertly. We appreciate you sharing your expertise on this topic. I do not have any specific questions at this time. I did have one attendee who is an adult who joined to say that she lives in Virginia, or she lived in Virginia, and she was able to get Medicaid until the age of 22. So I don't know if that the child Medicaid eligibility varies from state to state, but thank you for sharing that. So did anyone else have questions about Terry's content or about anything in the slides? I know that, Terry, you shared a lot of examples, obviously, from Children's Mercy where you work, and I think the intent was to, show those examples as something that you might bring to your healthcare provider when you're looking to really be an advocate and promote a smooth transition process for your family or for your child. So thank you so much for sharing your program, Terry, and what it is that you guys have set in place to really make that transition a success.
It was my privilege. Thanks very much.
Well, if no one else has any questions, you can all receive this recording or view this recording online on our website, www.ifopa.org. And I will also have links, because in the recording you won't be able to click on the slides. So I will also have the links that Terry has provided in the slides with the posting, so that you're able to go and click through to those as well. So thank you so much, everyone, for joining us, and I hope you enjoy the rest of your evening, and I look forward to accessing the presentation again or sharing it with your peers or community members who you think might benefit from it. So thank you so much.